Hello friends and welcome to all of you. ये है Bangalore camp and there is a patient Mr. Nagraj and he is comfortable in English. He will explain his situation from the beginning when he got the AVN and how he identified me and how he is feeling after taking the session. Yes, Nagraj, you can start.
Hi, sir. First of
Hi.
all, thanks for conducting this camp.
Yeah.
Since all the long you traveled from Kanpur to here and helping the people, and this doctor is a very good profession, I understand,
Yeah.
but you are helping a lot to the people.
Yeah.
So I got diagnosed with this avascular necrosis in 2024 in the month of April.
Okay.
So, as everybody knows that all the orthopedic doctors are suggested for the total hip replacement and core decompression, I was not much comfortable after getting the reviews from other friends.
Okay.
So it was not much helpful. Then I started exploring the alternate treatment therapies in Ayurvedic and all. So luckily I came to know that you are offering the very good treatment for particularly for this avascular necrosis. And I gone through your YouTube channels and exercise and I practiced and I met you in the OPD camp in the Bangalore.
Yeah.
And I started using the medicines what you prescribed and exercise, diet and other things. I feel comfortable and I have the confidence that I can take a session with you. And I completed my first session here and I feel better and there is a much difference and limping is gone and the pain, pricking pain and all those things are reduced actually. And medicines are really helpful and the way you are suggesting people, teaching people. So doctors normally outside we see just they only treat,
Yeah.
but you are treating and you are teaching how to come out of this problem. So
Yeah.
this will help to the patient for lifelong. This is a more advantage with you. Really, we are very thanks
Yeah.
for your all those things.
Yes. So what do you recommend to the other AVN patients, especially the young ones?
So, first of all, as doctors are suggested, diet is very important and exercise is very important. Moreover, punctuality is important. So, we have to do all the things we have to follow carefully: medicines, therapy, exercise, diet. These four things, if you maintain, then this problem we can come out as soon as possible. That's what I understand.
Thank you very
Thank
much,
you, sir.
and
Thank
I
you.
hope you all people get a lot of help from this. Thank you.